Hello, everyone, and thank you so much for joining us for our podcast. Really appreciate it. We've touched up on inflammation in our previous episodes, and we're going to be continuing with that and talk about the correlation between diseases in our body and the mouth, because they're all related. And today we have Dr. Kevin Chen, who's been my partner for a long time. We've been working together for a long time. Thank you so much, Dr. Chen, for joining us to talk about diabetes.
Hey, thank you, Dr. Towfighi. On this very important issue, and certainly love to be here and sharing with our audience about what diabetes is about.
Very good, very good. So let's talk about diabetes, and it's kind of a big word for our listeners. We hear it all the time. So just in a layman term, could you say what is diabetes?
Yeah, diabetes is a disorder. Obviously, affects over 21 million Americans. With rising incidences, meaning cases that are new every year, and then is growing at a very alarming rate of 500 cases a year. And so, what it is really a metabolic issue, meaning the body's inability to process blood sugar.
Okay.
And so, in the general term, that's in essence of what's going on with diabetes, right? Okay.
Very good. Very good. Okay. So diabetes, you say it's the ability of the body not be able to process sugar. So
Sure.
So why do we need sugar?
Well, sugar is our fuel,
Okay.
into cell functioning in terms of our everyday activities, and you have to have a way of modulating the sugar. Okay. And so, as we know, and as you know, the pancreas is what produces insulin. And the insulin obviously modulates the blood sugar. And when you have this imbalance of insulin or inability to process insulin or have insulin produced, you're going to have this imbalance with the blood sugar.
Okay.
And that becomes an issue in terms of your cell's ability to function.
To function.
Yeah.
So in essence, we need sugar to survive, and the body needs a way to process that sugar. And if you can't do it, or if you have these hormones that help you to process the sugar is not working, then we call that diabetes.
Absolutely.
Very good. Okay. So how do we diagnose it? How do we diagnose diabetes?
Yeah, in terms of, from your layman's perspective or our patients, you're going to see patients that are, sort of initially sort of sweating,
Okay.
right? These are symptoms, right?
Okay.
And someone who's actually going to be confused at times,
Okay.
and certainly lacking sort of the blood sugar, like we talked about in terms of functioning.
Okay.
So they're going to become, very agitated
Okay.
at times, and then also most importantly, these are things that lead to a lot of confusion, for the actual individual. But as far as scientifically of how we actually diagnose it, the current standard is the hemoglobin A1C.
Okay.
And so a normal individual like you and I who is not diabetic has a value of below 6.
Okay.
And someone who's borderline diabetic goes from 6 all the way to as far out as 12,
Okay.
even further.
Okay.
And so that's the major form of, testing that they do to diagnose today.
So you go see your physician, they draw some blood,
Yes.
and they do this specific test called the hemoglobin A1C.
That's correct.
And they can kind of determine whether you have diabetes or you have controlled diabetes,
Absolutely.
diabetic or not. Okay.
That's correct.
So of course, in our field of having the disease of the mouth, which we talked about previously, about periodontal
Sure.
disease, which is the inflammation of the bone and the gums. What are the signs? What do we see? How can we correlate this to diabetes? Why is that so important? How?
Yeah, sticking to the theme of, what we treat every day, which is an inflammatory disease, diabetes is a challenging aspect of, inflammatory disease as well, in the sense that your immune system is actually altered.
Okay.
And so it's in our inability to not only process the sugar on the metabolic side of it, but it's also our immune system being challenged, not being able to combat
Okay.
issues of bacteria insult, right? And what we do know many times is that the diabetes side of it versus non-diabetic, we harbor the same bacteria. But it's our inability to battle those same bacteria in the diabetic that leads to the symptoms of bone loss, and the findings that we see, right?
Okay.
Of the probing depth, the bleeding, and things of that nature, abscesses.
I see. So if you're a diabetic, especially not being a controlled diabetic individual, you can't fight the disease and the constant inflammation that's
Absolutely.
around our teeth. So
That's
hence, you could have the correlation between the two, basically.
That's correct.
Okay, so now we know if somebody has diabetes, they probably have a potential chance of not being able to fight the disease. So can you give me a little bit more of a link between gum disease and diabetes? Like if somebody has gum disease, will they have diabetes or vice versa? Or how does that work?
Well, someone who's actually uncontrolled diabetes, again, someone who's actually has a hemoglobin A1C test of beyond 6 and 6 plus. The issue with this is the fact that the immune system is affected, like I said, and how's that, influencing the periodontal side of it is that the inability for us to fight this particular bacterial insult has led to, the probing depth, the bone loss, right? The symptoms that we see, the clinical findings that we see. And many times, because of the same reasons of the immune system issues, you're going to see people with abscesses.
Okay.
And abscesses are essentially blow-ups, if you will, of the teeth. And so people are going to come in with significant amount of pain and discomfort, right? And they're going to say, well, guess what, doc? My mouth is now swollen, and so you're going to see a lot of these common complaints relating to that.
Very good. So one way, because they can't fight, normally the bacteria, they can kind of fight the disease, but now that they can't, you may have multiple swellings around some of the infection around the teeth. Okay.
Absolutely.
Okay, so you touched up on uncontrolled diabetic patients. What if we know a lot of patients have diabetes. What if they come in but they're actually controlled? They check their blood sugar all the time. They go see their physician all the time. They take their medication if they need to, or shoot with their insulin. What about them? Are they at the same risk as the uncontrolled?
No, and that's a great point, because the controlled diabetes are technically essentially folks that are hemoglobin A1C less than 6.
Okay.
They're normal.
Okay.
They're normal, meaning that they can receive treatments of, dental implants. They can go about their regular business in their dental care without having to worry about potential issues. And so we treat them as regular patients, and which is very different than uncontrolled diabetics.
I see. So controlled diabetic patients is pretty much healthy in
That's
a sense,
correct.
if they can control it effectively.
That's correct. Yes.
Okay, so suppose we have a patient that comes in the door and, you do all your testing, kind of your evaluation, do your medical history exam, and you find out, this individual is not controlled.
Sure.
Definitely they have an A1C of running 9.
Sure.
And you have, abscesses everywhere. So what would we do for this person?
Yeah, I think, first of all, we got to think of what we deal with differently. As of the other topics you have covered is the inflammatory aspect of the diseases.
Yes.
But most importantly is linked, as we know, as the body's linked with the mouth. So we got to work with our physicians, obviously, and making sure that our physicians are aware that our patient have this periodontal disease that they're dealing with, and it's linked to their diabetic status, right? And so through this process of working with them, our goal is to help the physician and the patient to lower the blood sugar the best we can.
Very good.
Because someone who's actually hemoglobin A1C of 9 is uncontrolled to the point where we can't really safely treat them in the office.
Very good.
Yes.
Okay. And so what would happen if we start working on this patient when they have uncontrolled diabetic? What can happen? I can just go in there and do all the work. What's going to happen if I just do that?
Yeah, the issue with it is that you're going to run into some, medical emergencies in the offices, and they need to know that they're putting their body at risk.
Okay. So that's that. And of course, they won't heal as well probably when we do surgery. Okay. Very good. So now we understand what diabetes is, and we want to make sure that our patients are pretty much controlled when they come to see us, so we can do the work on them. If not, we'll send them out or refer them to someone, so that make sure their physician gets them under control before we do anything. What about implants? I know a lot of people want to have implants and they want to place implants. So is it the same thing? Can they even receive implants? Can they even get implants?
Absolutely. And like we talked about earlier, a normal person who's diabetic that's well controlled, we treat them like normal patients. So they can certainly receive dental implants. Okay. But the uncontrolled diabetics, which again is someone who's has a range outside the range, would have to certainly reach out to the physicians and then get that diabetic control under control, and before we can actually do any sort of surgical treatment.
Okay.
Yeah.
Okay, so now we have a diabetic patient that, we got them under control. Now their diabetes under control. Very nice, healthy patient you can work on. You do your work and everything's all good. Okay, so now, of course, we know everything's about maintenance, not only our work, but of course their maintenance of maintaining their diabetes, so it's always under control.
Sure.
So what do we do in our office? Or what do you do when you have a patient that you already worked on, and now everything's all done? So what are the maintenance? What do we do for them?
Sure. I think that, you're looking at a couple of major things. Number one is continue to keep in contact with the physician, making sure that they're in diabetic control.
Okay.
And the second part is like what you're stating in our office, which is a regular cleaning every 3 months.
Okay.
And essentially looking for signs and symptoms of possible recurrence or a worsening of the diabetic symptoms, right? And if they are not, then we should be continuing on this path of keeping them on a healthy, periodontal status. And the 3 months maintenance certainly does that.
Does that help?
Yeah.
Very good. So you talk about the 3-month having cleanings done every 3 months. Is that only for diabetic patients?
No, I think that's a good practice for all periodontal patients, and certainly more so for diabetic patients to be under maintenance on a regular basis.
Okay, very good. So basically, most of our patients that we see, we're just going to try to talk about how maintenance is important. Every 3 months should be pretty much almost mandatory for all the patients with a history of having gum disease. Of course, diabetic patients are even more at risk, so we need to really have a close-up.
Yeah, and for sure, to your point, it's really about their condition that we're trying to maintain.
Yes.
It's not based on insurance, not based on anything else other than the fact that they have the condition we have to control.
Very good.
And also working with, again, them and also the physician to make sure that they're in maintenance. Yeah.
Okay. So for someone who's really interested to know more about diabetes, what resources are out there for them?
Yeah, that's a great question. I think obviously we first have them reach out to their medical doctors and certainly their family dentists.
Very good.
And from there, they can certainly refer to people like us, the periodontists. And as far as like online resources, our AAP, which is our academy, which is www.perio.org, and also our local state organization, calperio.org. I think those are good resources in finding out about diabetes and their link to periodontal disease. As far as scientific studies, your mentor, Brian Mealy, certainly well published in this, area. And that's a great resource from perio.org at the academy that people want to be more scientific. They can look this up.
They can look that up as well. Okay, great. Thank you so much, Dr. Chen, for joining us, giving all the great information for our audience. And thank you for taking the time to listen to us again. And remember, healthy mouth, healthy body.
And I would like to put a plug in that, every March is actually the Gum Awareness Month. So it's actually great for periodontists and great for our patients to have healthy gum.
Excellent. So if this is around that time, you're watching this around March, watch out for that.
There you go.
Thank you again.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.